perception is normal. So what are the risk factors? Their risk factors could be either predisposing or precipitating. The predisposing factors, a lot of it we have nothing to do with it. It's just basically who you are, 65 years of age or older. If a person has dementia, they're increased risk for delirium. Pre-existing functional impairment. So if a person is not able to mobilize independently, if they're not able to address and to be able to care for themselves, it leads to isolation, and it leads to delirium, becoming more delirious. Chronic diseases, chronic conditions. If you have a lot of chronic conditions, it could lead to delirium, because trying to manage one over the other, and always there will be a time when medications may be mixed up, managing your blood pressure, managing your COPD, managing your kidney failure, your heart conditions, sometimes just the multiple medications, and which one do you want to sacrifice for the other? Like, would you want the heart versus the kidney? So it's very difficult. So sometimes it's having multiple conditions and trying out the physicians and yourself trying to navigate treatment, and the best treatment can increase the risk of delirium. Male gender can't do anything about that. I don't know why the male gender is specifically singled out for having an increased risk. Sensory impairment, if you have hearing impairment or if you have visual impairments particularly, it could lead to delirium, because you can start hearing things and you start seeing things. Wear your glasses, wear your hearing aid. Yeah. Depression, and we talked about that a bit. Alcohol misuse, increasing because what alcohol does is dulls the senses, increases the risk for delirium. When somebody tells me they only have a glass of wine a day or 1 or 2 drinks a day, double that. Okay. Recently being in hospital, because hospital, it's important to be there when you need help, but also it can be dangerous to seniors. Okay. Having delirium, before we mentioned too, basically that it just increases risk for a second episode. And being age 85 or older, it does, because it just, the brain is getting more fragile. It just increases the risk for what to be toppled over with delirium. Some of the acute risk, the acute precipitating factors, medications, sedatives, sleeping pills. If you're not feeling well and you take your sleeping pill, and it may cause you to be groggy, confused the next morning. Anticholinergics, basically those are drugs basically that changes the neuroreceptors. And there are many drugs that are used, really, really important, but it will change the brain chemical that can predispose the person to become delirium. Any kind of acute illness. And as I mentioned, basically, pneumonia is one of them, because sometimes seniors may be at home and they've got pneumonia and they haven't visited the doctor, and especially seniors who are alone. And delirium just flares up. Very, very risky and tragic for persons like that. Infection, fever, UTIs, urinary tract infection is a culprit. And one of the things about urinary tract infection, when you're young and you have a urinary tract infection, you know right away. For a senior, it's not necessarily so, because you don't get those normal symptoms of really burning on urination. Sometimes you don't get that. Sometimes urine may be a bit cloudy, it may be a bit yellow, there may be a little bit of blood in it if you really notice. So, but sometimes you may not even notice. So that's why it's really important to get checked out. Surgery, chronic pain that's not being managed, and also pain medication, opioids. It could lend a person to become very, very confused. Dehydration, nutrition, hydration is really, really important. And basically any kind of abnormal blood work, and that basically comes with basically any of the chronic conditions that a person may be dealing with. And another one I'll bring in also too basically is heat. Now we're coming to summer. A lot of times, because as seniors, your skin gets thinner, you don't retain, you tend to feel cold, and so they may wear extra layers. Basically, when you have a really hot heat days and you're in, when you have a really hot days and no air conditioner and you're in the house, it becomes really, the body can overheat and become hyperthermia, and they can develop delirium. Actually, in the